Hello and welcome to the maiden episode of The Last Mile with NACA, a public enlightenment and sensitization series by the National Agency for the Control of AIDS, NACA. I'm Adesuwa Osui. Why and when was NACA created? What is its mandate? What are the strategies deployed in the push for the last mile in ending HIV deaths and new transmissions by the year 2030? The answers to these questions and more in just a moment. Don't go away.
The human immunodeficiency virus and acquired immunodeficiency syndrome, HIV and AIDS, has existed in Nigeria for over 30 years. The two index cases were discovered in 1985. In response to the devastating effect on both Nigeria's health and socio-economic status, the federal government set up the National Action Committee on AIDS in the year 2000. The National Agency for the Control of AIDS, NACA, was later established under an Act of Parliament on February 22, 2007 to coordinate the various HIV and AIDS interventions in the country. With the leadership of exceptional personalities with impeccable track records as its Directors General, the agency has ensured that the national HIV response has approached its last mile. Currently at the helm of affairs is Dr. Gambo Gumel Aliyu, a world-class epidemiologist and a public health specialist. Before his appointment to head NACA, Dr. Aliyu served as country director for the University of Maryland programs in Nigeria and assistant professor in epidemiology and public health at the University of Maryland School of Medicine. He was among the first Nigerians to receive in-depth trainings on establishing antiretroviral and the prevention of mother-to-child transmission centers of excellence. Over the last 15 years, he was vastly involved in HIV research and program evaluations to support decision-making. In 2005, he co-pioneered mobile HIV testing service delivery to key affected populations in the process of implementing an HIV seroconversion study in Nigeria. In 2017, he evaluated two national HIV treatment program strategies, Test and Start and Community Antiretroviral Therapy, critical to scale up of antiretroviral treatment for achievement of sustainable HIV epidemic control. He spearheaded the world's largest HIV population-based survey, Nigeria HIV and AIDS Indicator and Impact Survey, NAIS, which helped Nigeria to know the true status of the epidemic and impact of HIV services delivered in the last 15 years. Among other purposes, NACA's mandates are to coordinate and facilitate the mobilization of resources by all sectors and at all levels for an effective and sustainable response to HIV and AIDS in Nigeria.
NACA was established in 2007 solely to coordinate the national response for the control of HIV/AIDS. And this national response is a multi-sectoral in nature. So what NACA does is NACA coordinates all activities that are taking place in this and accounts for virtually everything that is happening in terms of prevention and treatment that is needed to control HIV in the country.
Dr. Gambo Aliyu's leadership style has greatly impacted NACA's culture, structure, and strategy in just a short time in office.
When I came, I made it clear that I have two goals. One is to control the epidemic, and two is to provide infrastructure for sustainability. I'm happy to say on the side of the control, we have recorded tremendous success, and we are looking at a year from now or a maximum 18 months to reach that bridge to say that HIV transmission is controlled in Nigeria. On the second part, providing infrastructure, when I came up, I had one office that we have here in Abuja. But now we have 7 offices all over the country. We have an office in each of the 6 geopolitical zones. That helps us to come closer to the community. That helps us to go closer to the grassroots to see what the development partners are doing in terms of helping us to control the epidemic, to see what other stakeholders in this multi-sectoral response are doing, to monitor and evaluate activities that are taking place by implementing partners at the grassroots, and to make sure our programs are adding and in terms of strength, are giving us strength, not duplicating each other, in terms of our implementation.
With his epidemiology background and a passion for data-driven implementation of the national response, Dr. Aliyu facilitated the creation of a central data repository for all HIV management in the country.
The importance of the repository is to help us monitor and evaluate. Before, we don't have means to monitor and evaluate. If I sit down here, I don't know what is happening in Taraba. I may not know what is happening in Abia. I may not know what is happening in Kano and other places in terms of how many people are taking treatment in what facilities and how these people are doing. But as I sit today, I can look into a system to know how many treatment facilities do we have, for instance, in Kano, and how many people do they have on treatment, whether these people are still on treatment or have dropped out of treatment. If they are still on treatment, how well are they doing in terms of making sure that this virus is controlled within them? Another thing we have done is that we've changed the way we do business here. We're now getting drugs at rates that are way cheaper than we have them before. When I came on board, we were buying drugs at a rate of $13 per patient per month. Now we are buying at a rate of $7 per patient per month. And we were buying test kits at the rate of almost $3 per test. Now we are buying test kits at a rate of less than $1.85. So we have done so well, in making good use of the little resources we have, and we have done so well in working with our development partners to make sure we are all out everywhere, and we focus our attention where we think HIV is spreading fast and HIV is identified more, to make sure we get people that have the disease, place them on treatment.
Currently, statistics show that NACA has done exceedingly well for the last mile push.
The last mile is saying that we are in the last lap of the race to control HIV and to make sure we move at the same pace or at the faster pace with the global community. When this marching order was given by the president for NACA to push for the last mile, we have done a tremendous job. When this marching order was given, I think we have about 800,000 people on treatment. Today, less than 3 years from that marching order, we have doubled the number. We have about 1.6 million people on treatment, and we are counting. And that has been a phenomenal job because we've done something that no other country in that respect has done in the world, identifying almost 350,000 people within a span of a year and a half or less and placing them on treatment. No country has ever done that, and we did that despite COVID-19.
Despite successes recorded, a lot more needs to be done by way of shared responsibility and accountability, responsible implementation, and stronger partnerships. But the National Agency for the Control of AIDS is not sitting on its oars, with an even stronger resolve as it pushes for the last mile.
As you must have learned, Nigeria has done tremendously well in the fight against HIV through the efforts of NACA. Support the HIV response, avoid indiscriminate sex, do not stigmatize or discriminate people living with the virus, and lastly, know your status and take action. Till next week on The Last Mile with NACA, I'm Adesuwa Osuyi. Goodbye.